Hello, and welcome to another edition of Black Health Matters. I'm your host, Daly-Mack, RN, and today we're continuing our discussion into a topic that affects countless lives across our state: mental health care in rural North Carolina. Yesterday was the end of National Minority Mental Health Awareness Month, but we need to keep the conversation going. Let's start by understanding the unique challenges faced by rural communities. In areas like ours, where resources are scarce, accessing mental health services can feel like navigating a maze. Limited providers, transportation barriers, and stigma all play a role. We see this played out here every day. I also want to talk about the role of law enforcement and local magistrates. Unfortunately, encounters with law enforcement can frequently exacerbate mental health crises. While we have been assured that law enforcement receives some sort of training, it still does not qualify them to handle extreme cases. There are already too many people in jail that need to be receiving treatment, which takes us back to the beginning of this discussion. They should be receiving treatment that they're not able to access for a myriad of reasons. To be honest, individuals in distress are often criminalized rather than supported. But all is not bleak. Communities are rallying together. Grassroots organizations, churches, and community centers are stepping up. The Northampton County NAACP is among the groups that is devising a plan to do just that. I am inviting others who may be interested to join us because this is an issue that affects us all. In future editions, I plan to highlight success stories like peer support networks and telehealth initiatives to bridge gaps. In this politically charged climate, I want you all to know that advocacy matters. Policy changes are required to make a difference. From funding allocations to training for law enforcement, there's hope for improvement if we all get involved and vote people into offices that can make policies that affect us in our community. That means you need to find out what the people you vote for stand for. Ask the questions. If they don't meet your needs, don't vote them in. Even more, vote them out. Replace them with someone that will. It is important that we stop focusing only on the big elections. Your local officials affect your life and what goes on around you much more than those at the top. We've certainly got a lot of work to do. I want to thank you for joining me today. Remember, mental health is everyone's concern. Let's keep the conversation going. If you are interested in joining with the NAACP Mental Health Coalition, or MHC, please call me at 252-532-6272. Until next time, take care of yourselves and each other, and always remember, Black health matters.